found that there was literature coming that the low dose is as effective with lesser side effects, so we shifted over to 600 milligram a day only. Moxie we gave 400 milligram to all the patients. And when we analyzed the results in January this year, we found the favorable outcome that included cure plus patients who remained culture negative for more than a year. So this was interim analysis. 72% of the patients, they had favorable outcome. Around 10%, that is 3 patients died, 3 patients defaulted, only 2 patients failed to the regimen. And in none of the case, we had to stop the entire regimen because of the adverse drug reactions. And one important thing was, which we had in mind, was comparing between XDR-TB and pre-XDR-TB. And we found in terms of favorable versus non-favorable failures and deaths, the outcome was comparable. And rather, failure was more in cases, both the failures were in pre-XDR group, giving very important message that pre-XDR-TB, don't take it lightly, this is as bad as XDR-TB. And the 26 patients achieved sputum conversion. The smear conversion was achieved in all these 26 cases within 5 months, and the culture within 6 months. Median time was 4 months for the conversion. Regarding the safety, in the mild ADR we defined where the drugs could be continued. In moderate adverse drug reaction, when we had to stop the drug for a few days and then start again, and severe when we had to completely stop the drug. And among the minor adverse drug reactions, the common ones were loss of appetite, loss of taste, anemia, and nausea and vomiting. And the others have been shown here. Among the major adverse drug reactions where we had to stop the drug permanently from the regimen, the 3 were because of the Venezuela after the 5. There were anemia, severe anemia, peripheral neuropathy, and optic neuritis. Optic neuritis one must keep in mind because that can lead to permanent blindness in case we don't stop it after this develops. But in case we stop it in an earlier stage, then this is completely reversible also. That was our experience and mentioned in literature as well. The one patient we had to stop the epinephrine because of the hearing loss, and in one we had to stop cyclosporine because of major psychosis. This is just one of the patients how dark brown became after using clofazimine. This is a patient with gynecomastia because of ethionamide. In 2 cases we had added surgery, and the indication was that of course the lesion should be localized and resectable, and patient is not responding to your drugs. And usually we perform surgery after 6-7 months of giving chemotherapy. Here in this case the left pneumonectomy was done, and here the right upper lobe lobectomy was done. So what we conclude from this small experience of RRS is that if we have an aggressive comprehensive management program, it can provide favorable outcome in almost 72% of patients with XDR-TB or pre-XDR-TB who have received